A neurological emergency refers to any sudden disorder affecting the nervous system that demands immediate medical intervention to prevent permanent damage, disability, or even death. In these situations, rapid identification and swift action are crucial, as delays can have devastating consequences. The general management of a neurological emergency unfolds through a series of well-structured steps, each designed to stabilize the patient and address the underlying cause without delay. The first priority is rapid assessment, focusing on the patient's airway, breathing, and circulation, the ABCs. Ensuring these vital functions are intact is paramount, and if any compromise is detected, prompt resuscitative measures must be initiated. Once stability is established, obtaining a brief but targeted history becomes essential. Attention should be paid to the exact time symptoms began, how they have evolved, any accompanying features such as headache, weakness, or seizures, and relevant past medical history, all of which help guide further management. A focused neurological examination follows, assessing the level of consciousness, often with the Glasgow Coma Scale, along with pupil size and reactivity, motor strength, speech, and cranial nerve function. This examination provides critical information about the severity and localization of the neurological insult. Immediate interventions are then tailored to the suspected emergency. For instance, in the case of seizures or status epilepticus, benzodiazepines like lorazepam are administered, airway protection is ensured, and vital signs are closely monitored. If a stroke is suspected, it is vital to determine when the patient was last seen. Well, activate the stroke protocol. Obtain an urgent non-contrast head CT. Check blood glucose, and rapidly assess eligibility for thrombolytic therapy. For increased intracranial pressure, elevating the head of the bed, optimizing ventilation, and considering agents like mannitol or hypertonic saline are important steps, often in consultation with neurosurgery. When meningitis or encephalitis is suspected, empiric antibiotics and antivirals should be started after drawing blood cultures and a lumbar puncture considered if it is safe to proceed. Throughout this process, supportive care remains a cornerstone. Maintaining adequate oxygenation, stable blood pressure, and normal glucose levels is essential to prevent secondary brain injury. Avoiding hypoxia, hypotension, hyperthermia, and hypoglycemia can significantly influence outcomes. Appropriate diagnostic investigations, including imaging such as CT or MRI, and laboratory tests like CBC, electrolytes, and coagulation profiles, are ordered based on clinical suspicion to help confirm the diagnosis and guide further treatment. Early involvement of specialists, whether neurology, neurosurgery, or critical care, is often necessary to ensure comprehensive and coordinated care. Ultimately, timely recognition and a systematic, multidisciplinary approach are fundamental in optimizing outcomes for patients facing neurological emergencies. Each step, from initial assessment to definitive intervention, plays a pivotal role in minimizing harm and improving the chances of recovery.